All right, good morning, everyone. My name is Farah, and I am a clinical social worker working at the LightHouse Arabia, and I specialize in working with grief, trauma, and also health psychology. And we're here really in celebration of Breast Cancer Awareness Month, and we're going to be speaking about really what we feel is the missing piece often of cancer care, which is speaking about the impact it can have on mental health. So I'm going to share my screen with you. And I'll speak for about 30 to 40 minutes, and then we'll have plenty of time for Q&A afterwards. And so for those of you who don't know who we are, we're the Lighthouse, and we're the largest outpatient mental health clinic in the Gulf region. We're a team of about 30 psychologists and 3 psychiatrists, and we're really on a mission to destigmatize mental health in the region. So we work with kind of all sectors. That's us in a nutshell. What we're going to be doing today is talking about really briefly, what is mental health? What is normal to be feeling when you have been given a diagnosis of cancer or breast cancer? If you've had a scare, if you are a caregiver, or you know someone in your personal or professional life who is living with cancer or a survivor, what's normal for them to be thinking, feeling, and how can they support themselves, but also what can you do to support them, and also the things that you don't want to be doing. Okay, and then we'll have Q&A. So when we think about what mental health is, because we want to make sure we understand that before we look at how does living with cancer impact our mental health. And we all have mental health, right? The same way every single person has physical health, we all have mental health. Mental health is not the same thing as mental illness, right? Mental illnesses would be things like depression, anxiety disorders, addiction, and so on, right? I want you to know that mental health is the health of our thoughts, our feelings, and our overall well-being, and we all have that. I want you to know that good mental health is not about feeling good, optimistic, and positive all of the time. It's about being able to experience the fullness of all of your emotions. So if you've had if you're going for a mammogram or some type of health screening and you're feeling a little bit anxious or you're feeling a little bit worried, especially if you have a family history of cancer or you know someone who's been impacted, it's actually very understandable that you're going to feel worried or sad or anxious, right? So good mental health is about being able to experience all of those emotions, because there's no such thing as negative emotions. They're all neutral. And emotions are our messengers, right? They kind of surface to tell us that we're feeling something or we need to notice or pay attention to something inside of us, okay? When we're looking at how prevalent mental health issues are, even when we're not looking at cancer, right? And these numbers are pre-pandemic, and some of these figures may look quite familiar to you. So we know that even if you are not experiencing cancer, that 1 in 4 people are struggling with their mental health, right? That means a quarter of the people on your teams, a quarter of the people in your lives, on your social media, right? And we can argue that these numbers are probably much higher because that statistic comes from people who have eventually sought professional help. We know that 2 in 3 people will never seek professional help, right? And when we look more closely at trends in minority communities, the numbers are even more exacerbated, where people just, help seeking rates are even lower. We know that mental illnesses do not care where you are from or how much money you have in the bank or what university you've went to. It impacts all of us equally. We know that every 40 seconds around the world, someone dies by suicide, and it tends to be more men than women. We also know that depression is the second most common illness of all illnesses worldwide, right? Number 1 is cardiovascular disease, okay? So when we look particularly at some of these prevalence rates of mental illnesses in cancer care, living with cancer or having survived cancer or knowing someone who is surviving with cancer or anywhere on that spectrum, right? It's an incredible risk factor. It makes that individual at an increased likelihood of experiencing things like addiction, anxiety disorders, or depression, because the very process of going through screenings, possibly receiving the news of the diagnoses, is a traumatic event in itself, right? And we know that when we look at individuals who are living with cancer, that a quarter of those individuals will experience things like depression or anxiety disorders, and also very commonly can be addiction. And what can be very upsetting is that these illnesses are often normalized, right? Where friends, family, and sometimes even within the medical community, there can be, well, of course they're depressed. Of course they're feeling anxious. They're, look at what they're experiencing, right? They say that in the first year when someone has been diagnosed, you will have more than 100 doctor's appointments, right? Let alone the disruption in your, we tend to hear cancer and the first reaction is death, right? And so the trauma of this, it's overwhelming. But living with an additional diagnoses of depression, anxiety disorders, and so on is actually not normal. And when we look at the research of what is the impact of living with cancer or breast cancer specifically and untreated depression, what they found was that pain symptoms are actually significantly worse if there's untreated depression. And there was another study done showing that a group of individuals who had depression and cancer untreated, they lived up to 10 years shorter lives. So left untreated, it can literally mean poorer health outcomes, increased pain, and also literally living a shorter life. So that's quite alarming to even hear. And when we're thinking about the trauma of surviving and living through cancer, imagine the added load of also experiencing untreated depression, right? There can be these really bittersweet golden nuggets that can sometimes surface with any type of health trauma and cancer, where people will almost start reflecting on their life and saying, I wish I had worked less, or I wish I had connected more, or taken risks on myself, or different things, where we call this, post-traumatic growth, right? And what you find with depression is the very ability to access meaning or joy in your life, right? Even in those simple moments, is taken away, right? Because it's one of those hallmark symptoms, not being able to enjoy pleasure. Imagine experiencing both together. And when you're going to your doctor or you're exhibiting signs, and family or friends are thinking, well, of course they're feeling that way. That's normal, but it's actually really not. So one of the things we will speak about is how do I know if I or someone in my life is experiencing depression? Because even if they're living with cancer, it is something that requires treatment. It's really important. I want you to know that for people who are living with cancer, or even have survived it, and we're speaking about caregivers too, that what has been happening this year with the pandemic has exacerbated risk and stress, right? Because now there's that added layer of being high risk and being quite fearful of, can I go outside? Will something happen to me? Will I survive? But also for friends and family of that loved one, there's that elevated worry of, what if I go and meet that friend and they have COVID, and then I give it to my loved one and I kill them? And you can imagine that the elevated anxiety that even friends, family, and caregivers are living with is an enormous risk factor, and the baseline of anxiety is going to be significantly raised, okay? And who are we talking about? I've been kind of alluding to this. So we're saying we're going to talk about what's normal to think and feel if you've recently received a diagnosis, because the trauma of that will look a little bit different. The trauma of that is not just for the person who has received the diagnosis, but also for individuals who are the loved ones, a spouse, family, friend, children, close colleagues and friends can also have a trauma reaction when you learn and are witnessing what a loved one or someone close to you is going through, right? This can also include, we're going to speak about caregivers if you are currently living with cancer, and also what can be normal to feel if you are a survivor, okay? So particularly looking at when, if someone has recently received a diagnosis, but this can also be if you're going, imagine you are waiting for certain test results and they come back. For many people, they may have a surgery and they're waiting to hear back, or after a stretch of chemotherapy, is it gone? Is the tumor shrinking? And receiving the news, poor news, can actually also be very traumatic, right? So, anywhere in that spectrum, when there is an emotionally overwhelming experience, right? It's like an invisible injury for your mind, right? And many people can experience what we call an acute stress reaction, right? It's like during this time, if you could see your heart and soul, it's like needing to be in the ICU, right? It's like an open wound. And it's really important during this time that many people understand that you may be functioning or look okay, but you're actually not okay, right? And this is a very physical, emotional, cognitive, spiritual disruption. I'll often have people say that during when they received a diagnosis, it feels like, almost like the world fractured, like not knowing what is up, down, left, right, which is often why it's so important that if you are going to appointments is to take someone with you, because your frontal lobe, that kind of higher order thinking part of your brain, it completely goes off when we think about our reaction to trauma. And this can be with cancer care, but it's also applicable for receiving any devastating health news of a chronic illness or other issues. Okay. I want you to know that there's really no right or wrong way to react. Each person's reaction is going to be as unique as their fingerprint. So you you may find that some people get, just tearful, angry, rage, reactive, anxious. They may even have a panic attack, right? So they may be really reactive in how they're feeling. And another person may implode inward, where they completely freeze and shut down, right? Not knowing what to say, not moving. And another common reaction is becoming extremely task focused. That means researching everything. Where do we go? What hospital do we go to? Who are the best doctors? What does this mean? Reading medical journals. And it's focusing on that practical bit. And sometimes we tend to imagine that this person is the strong one, that they're taking the news or they're living with their illness or their loved one's illness and they're being strong. And it's not that they're being strong, it's just that they're functioning, right? And we often misinterpret functioning as strength. And remember, you can be functioning and getting things done, but also be very, very broken inside. And usually that person will have a much more delayed reaction, where when they've understood and they've kind of managed the tasks, it's months later or weeks or months later where you begin to see them declining. It's more that they're having a delayed reaction. So what are the normal things to be feeling in those moments of trauma? There may be a lot of fear, anxiety, right? And that can be very understandable. A worry of what will happen, what does this mean? What does this mean for those around me? There can be that numbness, hollowness, emptiness. There can be a lot of guilt. Like, or even shame, like, did I do something wrong? Have I done something? And for many people, with all types of cancer and breast cancer, that can almost feel like your body has betrayed you. Like, what did I do? Should I have eaten differently? Should I have worked out differently? Was I not healthy enough? And there can be a lot of anger, guilt, or shame that is surfacing for people. Okay. There can be a sense of panic, shock, feeling really irritable, overwhelmed, frozen, right? And cognitively, remember, this is an invisible injury, right? So you can feel quite foggy, struggling to concentrate, disoriented, forgetful, almost feeling like things are a dream. Like, is this really real? Like, how is this happening to me? right? Me or our family or our team, okay? That can all of this would be a normal reaction, particularly when the news of something traumatic is very fresh, like a diagnosis, or waiting for test results, or receiving test results, right? So physically, there can be like almost feel like a heaviness or a knot in your chest or your throat. You can feel quite oversensitive to noise or light. And we're speaking about all of this in relation to cancer care today, but you'll also see that these are reactions to trauma, right? So fatigue, nausea, vomiting, dizziness, headaches, heart palpitations, muscle aches, disrupted sleep. And you'll notice that another reason why many of these things are missed is that sometimes they can also be a symptom of the treatment or the medicine, that exhaustion, that fatigue, where it can be hard to discern, is this a result of what's happening to me physically, or is something else going on that I'm missing, right? Behaviorally, there may be withdrawing. So it's very, very common that people with cancer say, and also caregivers will say, I find it so hard to relate to others. Like my world has just flipped upside down, and I don't care about my project in the same way, or I can't relate to my friends in the same way. I feel like I'm in the margins, in this strange place. I want you to know that that's very normal, right? That your very understanding of life and how you relate to people begins to shift. And there are larger existential questions that began surfacing. And I'll say that if you are in the acute stage where something has recently happened, it's very important that you're not trying to answer those questions, and you're trying not, and then really that you're avoiding making any major life decisions at that point. Like, don't get divorced, don't marry someone, don't quit your job, don't move house. It really, you would never say to someone in the ICU, what is the meaning of life, and why did this happen, and maybe we should leave this country. And during these times of crisis, it's more about going back to survival mode, right? Now, it can also be normal to be quite tearful or see some changes in speech, okay? There can also be very large spiritual and existential questions, as I mentioned. So there may be a search for meaning, like, why did this happen to me? Like, did I do something wrong, or am I being punished or some way? Or that question where people say, why do bad things happen to good people? It's really important that you do not necessarily try, if you're supporting someone, don't try to answer these questions. That answering that question is going to be a journey. And I will say that typically there is no answer to the question why that is ever gratifying when cancer does impact someone's life or a family. Okay, it's more about being with. So if you are in crisis or you've recently been diagnosed, you're on that journey, it's really important that you give yourself permission to feel all of your feelings. Okay, so we don't want to block them. So imagine like a big teapot where difficult emotions are like the pressure rising, rising, rising. Kind of have to let the pressure, the steam out, which is a healthy reaction. When we store the emotions in our body, we're like distracting, I'll just work, I won't process it, I won't think about it. It's like accumulating debt on a credit card, right? It's there because the body keeps score. So it's really important that you let yourself feel, process anything or any of those emotions that are coming up for you. And I'm mindful that many of us we don't know how to feel our feelings. So start by 30 seconds, 1 minute, 2 minutes of just sitting with those emotions, getting really curious and creative, like, what color is it? Where do I feel this sadness in my physical body, in my heart, in my ankles? What does it look like? Right? And not trying to solve it, just being with it, like you're sitting beside it. Right? Sometimes I like to imagine if that particular emotion, let's say worry, was a guest that, maybe an uninvited guest that comes in, right? And you're almost just kind of observing what's happening, where is it? You don't want them to be there, right? But being kind, permitting for it to happen, allows the emotion to come, and it also allows that wave to pass. Okay? I want you to know that there's no right or wrong way to feel. right? All emotions are permitted. It's really important that you're not judging, like, should I be crying more? Should I not? Should I be moving? Like, well, is something wrong with me? Should I be able to function more? I find even with cancer care, there can be so many harmful images on social media where people are comparing themselves to other survivors. And they'll say, well, she looks like this and she's doing this and she's fundraising. And should I be doing more? Right? It's so important you're not judging yourself, right? That can be really, it almost weakens our emotional immune system. Okay. When we are in crisis, it's important that you go back to taking your days blocks at a time. So don't focus on what will I do in the next 2 weeks? What is my treatment plan in 3 months and 6 months? In that state of crisis, it's more about what will I do today to take care of myself? What can I do this week that would be comforting, right? Just like we're almost like bringing our brain back online, right? And going back to those basics. So sleep, water, nutrition, and some gentle movement. Okay. The things that you do not want to do after crisis has taken place, right? And remember when we're saying crisis, like diagnoses, right? Uh, even a close call or a scare, like the mammogram comes back positive and you're waiting for biopsy results. That in itself can induce many of those symptoms of trauma itself. Okay, and I find that even as you're waiting for appointments, right? Imagine you're waiting for biopsy results and you have that first appointment with an oncologist. You're like, is it positive? What stage is it? Am I going to live? Am I going to die? What's going to happen? That can induce trauma, right? And even if you get the news of, okay, it's actually not, or it's benign, or, all of that, it isn't until you see that someone has also survived through traumatic circumstances that it's like when you're looking back, you can also say, wow, like, I can't believe that just happened to me. I cannot believe I've even survived that. You can also see people's health start to decline. Okay. So don't feel forced to talk about it. You do not have to share the details. If you want to, you can. But if a loved one is saying, like, tell me what happened, like, walk me through it, what happened with your procedure, what did it feel like for you, that can to reshare the details can actually be triggering. If you want to, you can. But if you're not comfortable, don't do that. You want to avoid drugs or alcohol. That can worsen things for our mental health. If you're feeling anxious, do not have caffeine, right? That will exacerbate anxiety, especially if you have something anxiety provoking coming up. I've already mentioned some of these. Okay, so if you are living with the breast cancer, here are some normal things to be feeling, right? Because, and we're speaking about the mental health aspect. I'm not speaking about the medical component, right? And so there is an enormous grief process that is triggered, that lives alongside living with cancer. And that grief is the loss of the dream of leading a healthy life, right? Because no one ever dreams that at some point in their life they would be touched by cancer. Even if we kind of abstractly, intellectually know that it can be common, we don't think it will impact us. And so there is the loss of the sense of safety and security in life. And when we are grieving that, and health and hair and body, especially when we look at breast cancer, if there's been, a mastectomy to some degree, there's that loss of your body, of femininity, of all of these things we can attribute our life to, the way you may have looked, feeling energetic in your life, working a certain way. And so when we think of the very nature of grief, right, which is not a clinical disorder, it's a loss of all of these things. And the nature of grief is that it comes in unexpected waves. So it's like having your back to the ocean and never knowing when those waves may come, when they will come, what size they will be, what form they will take. And wrapped in those waves can be anger, sadness, guilt, shame, confusion, exhaustion, hopelessness, right? It's really any possible emotion you can think of, and it's super physical. And so really commonly people will say, I often feel like I'm losing control. where sometimes I feel okay and optimistic and I feel like I'm getting through this. And other days or weeks I can feel exhausted and hopeless and terrified, right? And it's so important that you are allowing yourself to feel those emotions and knowing that you're not going crazy, right? It's the very nature of living with grief. And it's also important that even if you have survived or a loved one has survived, that there will also be the grief in you of, I cannot believe that we experienced this. And now that once a year there's that check and we feel terrified and traumatized that what if it returns? What if it comes back? Or what if it happens to me? Right? So the very nature of that grief is normal, and it's not easy, but it's normal, and it's actually a healthy reaction. And it's important that you allow yourself to feel that. Okay. I've already named that with something I find with people who are survivors of cancer. Sometimes people will react to them in a very kind of unhelpful way, which is, you're all better now, right? Thank God. Like, things are great. And for many people who are survivors, the impact of their treatment, physically, emotionally, it will last quite a very long time. What chemotherapy can do is just unbelievable. And they can say, well, I've returned to work now. And everyone's like, you're good. And, yeah, like you made it. And they're thinking, I'm not the same. And I actually still feel really exhausted by what I've just survived through. I want you to know that grief does not finish once you're a survivor. Even as you're looking back and thinking, I cannot believe we survived that. I survived that, right? That there can be those waves of different emotions that surface. And grief can get softer with time, but it never truly finishes. Or even 50 years, you can be looking back and thinking, I can't believe I went through that, or that happened to me or to my loved one. For many people, there can also be survivor's guilt, right? Which is saying, like, why did I live when I know others who have not survived, right? It's really important that you are compassionate to yourself when you experience that, right? Where you're not shaming yourself. It's also normal that if your life has been touched by cancer in some way, there can be elevated health anxiety where it's almost like this burst, like this like bubble that we have around us of safety bursts, right? Where we can feel less safe. Even going to a regular checkup can feel like, what if something bad happens? Because there is now a template in your mind that something bad may happen because you have lived through that yourself or with a friend or family member. So that health anxiety can be a bit elevated. It doesn't mean that you're crazy. And for many people, there can be what we call post-traumatic growth. And this is where you hear people not only that have survived, but also who are living through cancer or with loved ones can say, there are these very bittersweet nuggets of wisdom that have come with this very, very tragic experience that we would wish upon no one, which is we're spending more time together. We're being more honest together. Our perspective on life has changed in some way. And that is what we call post-traumatic growth. It doesn't make the entire process any easier, but you can see this surfacing, right? Where people will say, I'm more loving or I'm more present in my life because of this, although I would never wish for this to happen. Okay. So I want to spend a little bit of time very quickly talking about what are some of the signs that someone who is touched by cancer in some way may be experiencing depression, because this is not normal. We'll also speak about anxiety disorders, and then we'll talk about how to support someone who is experiencing cancer, okay, or a survivor. So when we look at clinical depression, right, it is not just a sad time, right? At most, it's being completely numb and devoid of emotion altogether. So, and it's not just a few days, right? It's going to be most days for at least several weeks or even much longer. There's that exhaustion, depletion, which can be a part of living with cancer. One of those hallmark signs will be no longer enjoying things that once brought pleasure. So now even those little things are not bringing even some comfort. And the very nature of life feels pointless, where there can be most days the outlook is, well, what's the point anyways? Or a sense of hopelessness, or a pervasive cynicism. You can also see that there are suicidal thoughts. And I want you to know that suicidal thoughts are really a mental health crisis, right? And so you'd want to get someone connected to professional help. There can be a lot of shame, guilt, or hopelessness. And those are some of those core signs of depression, right? So if you notice someone is experiencing this with cancer or a caregiver, it's really important we don't dismiss it and say, well, of course they're upset. Look what's going on in that family's life or in that person's life, okay? You want to get them connected to professional help. And I'll say, remember, depression is extremely biological. It's not just about someone's thinking, right? If we look at the very architecture of a depressed individual's sleep, it is completely thrown off. If we look at the stress hormones in their body, you'll see cortisol and adrenaline is through the roof. So much so that, we tend to think that the depressed person is like sloth-like. But when we look at what's happening in their body, it's actually like there's an inner war happening with stress levels. Okay. So it's really important that we're treating that. You can also see with cancer care and depression, imagine having like 100 appointments in a year and experiencing depression and cancer, right? You may notice they're not going to appointments anymore. They're not taking their medication anymore, right? Whereas they may have been caring for their appearance in a certain way, they don't care in the same way anymore. So you'll notice a lot of differences in them. And it's not just a few days, right? It's quite pervasive. It's most days. And when we're speaking about clinical anxiety, and remember, we all have anxiety. And if someone's feeling worried because of their health, if they're moving through cancer, of course there will be elevated anxiety. That's actually a healthy reaction, right? But what you'll see with clinical anxiety is the level of fear doesn't necessarily match the situation, right? So even with living with cancer, there can be kind of waves of elevated anxiety, right? Sometimes more paralyzing than others. Imagine someone experiencing the level of anxiety like they're waiting for a test result when they're not, and they're just waking up in the morning. And maybe they're in remission, right? Where the level of fear does not match the current situation for an extended period of time, right? It can be quite debilitating. So you'll see excessive worrying, fear. It's very, very physical. So you can see a heart racing. You may even see panic attacks, which are a mental health crisis. If you notice someone is having panic attacks, they must get connected to professional help to really be looking at what's going on there, okay? So just kind of summarizing here, clinical anxiety is more pervasive. It's severe, it's long lasting. You may see suicidal thoughts or behavior. There can also be a very loud inner critic, right? Like being excessively worried about things, being really hard on themselves. And many of the symptoms of clinical anxiety are similar to depression. They can really overlap. You can actually have both. It's quite common. And you'll find with depression, the pervasive feeling is sadness. And with clinical anxiety, it's excessive worry. Right? So depression can often be looking back, and anxiety is often looking forward, worry about the future. Okay, that's it in a nutshell. So we'll talk about some of the things you can do to safeguard your mental health and then how to support others. And I've said this quite a few times, which is, and I'll say it all the time, I'll probably say it for all of my life, which is give yourself permission to feel your feelings. And there's a really great book, it's called Permission to Feel by Mark Brackett. It's newer, it's really great. It's all on this topic. So feel your feelings, but also acknowledge, right? What can I do this week or this month to control what is happening? What are the things that are in my control that I can focus on? Now, what people tend to do is they'll say, well, I'll only focus on what I can control, so I'll dismiss my feelings. No, you must acknowledge the feeling. I don't know why my finger came out like a teacher, but you must acknowledge the feeling, let yourself feel it, and also be saying, well, I'm really hurting today. Well, what are the things that would be comforting or soothing that I can focus on today? Okay. You want to limit the news, especially if you're feeling a bit vulnerable, because it can be very traumatic. Right? I would want you to consciously work on getting explicit about asking friends, family, coworkers what you need. Because if you're living with this or even a survivor, what you need can change month to month. And most people don't know what you need. Right? They don't know, does this person, does she need more flexibility? Does she need time off? Does she want to come in? So be really curious about what would be helpful for me this week or this month, and being explicit to asking your partner, asking family, or your manager as well. Okay. Counseling can be really helpful. Deep breathing is so important. And making sure that you're, and I'll say this, I know breath seems like obvious, but gosh, there's so much science behind it, right? And typically when we're stressed, our breathing becomes very shallow. So I would say even starting with 30 seconds, 2 minutes of it, of just giving that gift to your body of deep breathing, right? So maybe we can all do that together right now. So in through your nose and out through your mouth. You've just given your body a gift. Your actually your physical body and your brain. So being conscious and intentional about that, and also making sure that you're celebrating small victories. I find that with cancer care, there can be such a focus on we have to beat this, we have to get through this, we have to be okay. It's so important you allow yourself to say, I survived today, or I survived this week. And also knowing that self-compassion is so important. And we often confuse being strong with the absence of feeling fear or worry or sadness or confusion. You can be, I think, or I believe that when we feel and express all of our emotions, even the ones that can bring us to our knees, that is strength. It requires courage to feel your feelings. Strength in numbing out your feelings is not actual strength, right? And when I say feel your feelings, look at how many there are. And if you kind of look at this, sit with this, take a picture of it, I will send it to you. You will become an kind of emotional intelligence Jedi. We know that research tells us people only know 3 emotions: happy, sad, and angry. There's actually so many, and they vary in intensity as well. So get really curious about what is coming up for me this week, what is coming up for me this month. Okay. So, how to support others. And whenever someone is experiencing a health crisis or living with cancer, more important than what you say is going to be how you listen, right? People will forget. I'm plagiarizing Maya Angelou now, but people will forget what you say, but they will not forget how you make them feel. Okay. And we tend to be almost like a bit obsessed with like fixing and solving, not only with others, but also with ourselves. And if you tend to dismiss your own emotions, or you can be very, very solution focused with yourself, which is not a bad thing. I like solutions. But if you're also not sitting with and acknowledging, identifying what you're feeling, then that's not really an empathic response. So if you dismiss you, you're going to do it to others as well. So start between you and you. So the things you do want to do, if someone in your life has been impacted by cancer, right? Personally or professionally, do not avoid saying cancer. I'll often have people say like, no one's saying it. And I find that in the first few weeks and the first few months, everyone's talking about it. Like, how are you doing? What's happening? What's going on? And I find this not just with cancer, but also any kind of health trauma or kind of degenerative disease or chronic illness. The initial diagnosis periods, people are asking, they're like, how are you? What's happening? And then they just stop. It's like, if I say cancer, I'll upset them, or, I'll freak them out, and I don't want to upset them. You're not reminding that person that they are living with cancer or their loved one is. You're actually reminding them that you remembered. So don't be afraid of saying that. Like, how are you doing? How is your care going? So don't avoid it. Do not try to fix what they're feeling. It's more about listening and trying to understand. Okay. And I'll come back to that one, like what statements are fixing statements. You don't want to force them to share details that can re-traumatize them. If they do want to share, that's okay. Do not discourage people from crying, right? You don't want to say, oh, don't worry, it's going to be okay. Give them the tissue box. Allow people to cry and to sit with that, which can be really uncomfortable, right? Even in our therapy office, in my therapy office at the Lighthouse, I keep the tissue box beside the person, but I don't hand it to them, okay? Because that says stop crying. It's really understandable if you're crying and you're upset. It can be quite scary, right? Don't discourage people from expressing their feelings. I'll come back to that one as well, like which statements do that. And we never want to express pity. No one likes pity, no matter what they are going through. And pity is very similar to sympathy. Oh, I feel so bad for you, right? It actually creates disconnect. I would describe sympathy as superficial empathy. It's like I'm saying it, but I'm not feeling it with you. Okay. And no one likes that. So the things you don't want to say, it could have been worse. Okay? You have to just be positive. Okay? Stop being so negative. Never give up. Because that person may be thinking, today I don't want to go on. Right? And that's an understandable emotion to have. You don't want to try to fix what they're feeling. Allow them to feel those things. Okay. Don't say things like be strong. And I cannot tell you how much I have heard, how much people hate that, be strong. If there's been grief or cancer or really so many types of health trauma, you surviving and allowing yourself to feel everything is being strong. And strength is not the absence of fear. Okay. Don't say things like it will all be okay. You don't know that. You can't often guarantee that. And the person can be thinking, I don't know if it's going to be okay. How do you know it's going to be okay? Right. So make sure you don't say that, even though I know this sounds counterintuitive. Okay. Don't say things like, oh, you shouldn't feel that way. Right. Allow them to feel anything that they are. Or things like you have to be strong for your spouse, you have to be strong for your children. That's not helpful. And empathy never ever begins with at least. At least they caught it at this stage. At least you have resources. At least you have good doctors. At least you are in Dubai. At least is how we minimize and we diminish. And if you tend to do these things to yourself around other issues, you will do it to others as well. So make sure you're not saying these things to you, right? And if you're reading this and you've said these things to someone, please be compassionate to yourself, right? It's only when we know better that we can do better, okay? So the things that you do want to do, offer solidarity through listening. And I promise you, listening is a skill. The more you practice it, the better you'll get. So start today, speaking to a friend or your spouse, and they say, gosh, today was so stressful. Okay, well, what part of it was stressful? What was that? Tell me more about that. And if you're listening, practicing that muscle, it's going to help you support people moving through adversity and cancer. Offer practical support. And remember, the research tells us if you say to someone, if you need anything, I'm here, people do not reach out. Yeah, so be more specific. Like, can I help you with a certain task this week? Can I help you make a certain appointment? Or can I help you research something? Can I help you with groceries? Can I help you pick up the kids? So be specific, okay? You want to keep up caring contact, right? So that may be checking in once a week or even once a month, depending on your relationship, and saying, how has this month been for you? Tell me more about what it's been like. I'm thinking of you. Okay. All right. So the things you want to say, we're offering empathy, hope, and validation. I'm sure it feels hard to be positive in a situation like this. I can't imagine what this has been like for you. I'm here to listen if you'd like to talk. This is really tough. I am here with you. I'd like to help with something specific today or this week. Is that okay? What has this week or month been like for you? And that's so important because remember, when we're speaking about grief, their emotional experience will shift from week to week and month to month. So one week they may be feeling really optimistic and good. And the next few weeks, they may be feeling really hopeless and terrified and scared. The grief reaction continues to shift. So make sure you're acknowledging that. And if you're a manager or a leader, or you have someone on your team that's living with cancer, it makes it extra important to check in with them and say, even cancer, but also chronic conditions, saying like, what has this month been like for you? Is there anything you need? Because there's really no one size fits all response, right? And I find that with cancer care and even chronic illnesses, you find that workplaces and also friends and family, they kind of are like, well, you're doing better now, right? Like you're okay now, right? And the person's like, well, not much has changed, but I'm still in pain, but yeah, okay, things are better. And people will feel like a burden that, actually, I still feel it's the same. So don't put that pressure on them, and know that it's important to keep an open channel of communication with that person, especially in the workplace. Okay. I've often have had people say to me, "Well, I've survived. I'm clear now, and I'm back at work." And everyone's like, "You're back. You'll be the person you were before you had cancer." And they're like, I'm pretty exhausted from the treatment I've had, and I don't feel the same way, right?" And the person themselves is learning. How am I different now that I have survived? They themselves may not know what their parameters and limits are. So be curious and keep open that channel of communication. Okay. So you can ask, what can we do this month to support you? Encourage them to ask for what you need, because of course you are not a mind reader, and encourage them to care for themselves. So you may ask, what have you been doing this week, this month, today to take care of yourself? Right. So we do have a free of charge coping with cancer support group. We have this every month. We've had it for, I think, almost 2 years now. And we really have about 15 support groups that are free of charge on a range of issues like grief and motherhood and the Beirut trauma explosion, and many different things that you can take a look at. Okay. So what we're going to do now, I think we have 10 minutes left. I'm going to stop sharing. And I'm going to take any questions, any thoughts or reactions that are coming up for you now. And you can leave them anonymously in the Q&A section. I hope I haven't upset you all. I know it was quite a heavy topic. Any questions? I don't see any coming in just yet. So I'm not getting any questions. I'm getting some nice feedback. That's very nice. You're welcome. Any other reactions or experiences that people have had would you like to share? I'm wondering if anyone would be open to sharing what their experiences have been like with friends, family, or on their teams, and how you feel it was responded to. So we have someone sharing, hi, I'm a cancer survivor. I worry about recurrence and Google to stay updated or know more about recurrence. Is that a good thing? So I think that that's a very understandable reaction to have. Where there's that anxiety of what if it returns, what if it comes back, and how do I stay on top of the knowledge? I would say that I want you to be very conscious of not doing that on days where you may be feeling anxious or worried or stressed about other things, where there are more boundaries around how much can be too much research. Because sometimes when we're feeling anxious, that grief reaction, right? Like, I can't believe I've lived through that. That what you may be doing is researching to manage the anxiety rather than sitting with it and saying, I feel worried today, and I feel sad today, and I feel really afraid that it may return. And that's where you must allow yourself to feel the feeling. And I think there's room for research in there too, but make sure you're feeling it and acknowledging that as well. Because too much research can also be, it can be harmful. Because when you're reading, right, when you're reading something and you think, what if it comes back? Your mind cannot discern between the thought and the reality. It can actually activate the fight or flight response in your body. And I would want you to make sure you have parameters around that. The same way I wouldn't want anyone to just be um, almost impulsively, unconsciously checking the news, because you could be sitting there and you see an image of something, a video of something, and you're actually traumatized, right? So make sure that you are looking at the entirety of your physical and emotional health before you start researching or even checking the news. I hope that answers your question. Any other thoughts, questions, reactions? I don't see any coming through, but I'm just going to hang around for a few more minutes. If you have any questions, otherwise, thank you for taking the time to attend this talk in celebration of breast cancer awareness. And I hope that as you transition back into your working day, that you're also being quite gentle with yourself and being curious about what did that, even if you haven't been touched by cancer, right? And you're thinking, wow, like, what must that be like? Or how did I respond to that person? Make sure you're creating some space to just process all of that. So we have a question, any food that we need to avoid for having a cancer? I am not a medical professional or an oncologist, so I would say definitely ask your doctor. But from my kind of amateur understanding, you would want to avoid things that are processed or preservatives. I'm not gonna give any nutritional advice. So we have a comment. It would be great to do a PSA on the importance of not falling for the plethora of fake information and do-it-yourself treatments for cancer. They circulate very much in the region. Yeah, it's so important that we have these evidence-based resources we go to. And I feel the same way, not only about medical treatments, but also like mental health treatments, and making sure that you're going to licensed, accredited clinics and professionals is so important. We'll often hear of people seeing life coaches that, not that coaches can't be great, but life coaches are not trained in treating mental illnesses like depression and anxiety or trauma. So it's important that we know how to find the right professionals and the right evidence-based websites and treatments. That's a good point. So we have another question. Thank you. Is it good to talk about my cancer experience with my kids, as I normally don't talk about it with them? I don't want to burden or make them afraid. It really depends on their age and how you speak about it, but it is important that you acknowledge to them that mom is not feeling well, mom is experiencing an illness and she is getting treatment, and using very child-friendly language to explain it to them, because children are so intuitive. So you can imagine that there is a sense of, why is mom going to so many appointments? Why is mom tired? Why does her hair look different? Why does her body look different? And when we are not speaking to them kind of clearly and honestly, and you don't have to share all the details, but it's acknowledging that something is happening in the family and mom is going through it. And there are some really great, I don't know the names right now, but there are some very great friendly books on speaking to them about cancer that can help as well. But children, when they don't know, they'll kind of make up stories around what's happening, and they can have a lot of anxiety. So it is important to be honest with children, but use child-friendly words, right? Young children cannot sit with big emotions for very long, right? And so they may ask a lot of the same questions over and over again. You also want to make sure when you do speak to them that your emotions are not overwhelming, right? It's okay to show some emotion and to say, you know, mom and dad are sad about this. This is hard, but here's what we're doing. But to fall apart completely in front of the children can actually be really overwhelming and destabilizing for them. So my experience was quite complicated. The relation with my partner was exacerbated and I struggled to connect. I have been told that acknowledging was the first thing to do. However, acknowledging paranoid thoughts ends up to validate them. It's tricky. How to help a panicking partner back to rational thoughts. So I'm wondering, were you the one who had an experience with cancer, or was your partner the one that was um, experiencing it and panicking, and maybe you felt like he or she was not having rational thoughts? Now, anytime someone in our life is kind of we'd say like not having rational thoughts, or maybe they're just expressing difficult emotions, where you can say, I'm terrified, I feel like I'm going to die, like what if something happens? It's important that we acknowledge the emotion. Our emotions are not always rational. And something that's so helpful is allowing them to be heard. So you can say, well, I'll make this person's name up, you know, well, Susan, what I'm hearing is that you're really afraid. And while the doctor or our plan moving forward is XYZ, and here's the information we have, I can see that you're really terrified. So you want to acknowledge the emotion, because it's understandable that we will have many thoughts and feelings that are not rational. Yeah. Yeah. So yeah. So it was her having the cancer. So we have another comment. I have a family member who has been in remission for 5 years. However, she's still experiencing depression. And I find it hard that I can't be there for her as I am overseas. Phone video calls just aren't the same. I feel some guilt that it falls to other family members. Yeah, it's really hard. I think being far is so complex, and you want to connect, but when you do connect on the phone or video, it feels somewhat ungratifying. And it's like, how do I connect in a meaningful way? And I would say, even if you connect minimally, but you find a way where it feels like quality, I would encourage you to do that. And that may be an email, right? And saying to them, I'm making up this fake name now. If this person's name is Susan, I don't even know. But, you know, like, Susan, I've been thinking about you a lot, and it's really difficult for me to communicate my thoughts and feelings with you virtually. But I want you to know that I think about you a lot. I wish I could connect with you more. I often feel guilty that I haven't connected with you more, but I wanted you to know that I care. That in itself can feel more quality, right? Even if that's once in a while, and naming that can be really helpful, right? So thank you everyone for taking the time to attend. I hope you have a lovely rest of the day. Bye.